Other news now, Oregon's registered nurses tomorrow will lobby the legislature for better working conditions. They want less overtime, fewer hours, and fewer patients.
They say their workload leads to nurse burnout, and for patients, increases the risk of infection, hemorrhage, and stroke. Hospitals say their nurses are doing a good job, and they'd hire more if there were more to hire. The Northwest Health Foundation calls Oregon's shortage of registered nurses a public health crisis in the making. Steps are being taken to alleviate it, but the RNs say hospitals give them too many patients.
We want a maximum number per nurse at any given moment.
Hospitals say that's too rigid and doesn't allow for the ever-changing patient load.
You can't just say you must have this number of nurses and expect that those nurses are waiting in the wings to come work.
The 2005 legislature passed a law requiring hospitals to set staffing levels by committee, half RNs and half management. A hospital spokeswoman says they've only begun to implement that law. Let's give it a chance.
It has such tremendous promise to bring direct care nurses into that decision-making process about how many nurses they'll have on their unit and how the care is being provided.
This is what I call unshared governance. We're on the committee, but we don't really have a say.
The RNs say they never know how many or what kind of patients they'll face on a shift. That work environment, they contend, is driving nurses out of the profession and adding to the shortage and creating unsafe conditions for patients.
We took an oath to do no harm.
A 1999 California law sets staffing ratios. When hospitals there can't meet them with homegrown nurses, they must go to agencies.
We're forced to hire very expensive nursing staff to come in and meet these mandates, and it's just driving up the cost of care.
Certainly money in the form of costs and compensation is an issue in this debate. Yet both sides insist patient care is their main concern. Oregon's Subcommittee on Health Policy will host the first public hearing on this bill. It's 3416, and the hearing will be tomorrow at 1 o'clock.